And I think what is out there is you get fixed and you don't always get fixed. And that's kind of where we've got to change that narrative and support those that don't get fixed.
Welcome to the Conditions for Recovery podcast. I'm George, a specialist pain physiotherapist and coach. If you live with chronic illness, you'll probably relate to how easy it is to get lost in hopelessness, whether it's from healthcare appointments, which lead to more questions than answers, the endless stream of despair content online, or just not knowing how to navigate the world when your symptoms aren't helping. I started this podcast to share the voices of people who have found another way, centering hope and agency as core first principles of recovery to show that another reality is possible. Today's guest is Katy Frost. I first encountered Katy on LinkedIn, where she was active on a lot of posts from other voices in the chronic illness space that really resonated with me. Katy is an illustrator by background who has lived with persistent pain for the past 4 years. During that time, she recognized something that will resonate with a lot of listeners, that the current way we communicate modern pain science and self-management just aren't working. To Katy, this information often feels inaccessible, clinically biased, or to put it bluntly, just misses the point. To fix this, she created Bob the Stickman. Bob is a character designed to make pain visuals approachable, blunt, and actually useful for the people who need them most. I love Katy's work because she uses humour and personal insight to spark conversations that are long overdue, and I'm really looking forward to talking to her. Hi Katy, thanks for joining me today.
Hi George, thanks for having me here. I must admit I'm a little bit nervous. I've not done this before, so bear with me.
That's okay. I think we're both in a similar boat, and I'm really glad that you're the first person I'm doing it with too. So for people who don't know you, can you share a little bit about your story?
So yeah, as you said, I'm an illustrator, and I want to change things using my lived experience. My lived experience is 4 years ago, I had a really freak accident and hurt both my ankles, and that left me for a considerably long time in bed and a long recovery, but the recovery didn't actually make a full recovery, if that makes sense. Also hurt my back about a year into the recovery, and that also isn't better. So I'm now dealing with ankle and back pain, and basically that's where it all started, and it's been quite a journey.
Yeah, absolutely. And what kind of things were said to you in the beginning by either healthcare professionals or other information? I know that you said to me before that actually some of it has been less forthcoming than you'd hoped or expected.
So basically I was sent home from hospital with no help whatsoever. I literally couldn't even get to the bathroom. So I actually was lucky enough to pay someone to come out, a physio to come out and teach me how to get to the bathroom. And she also told me about community physios, and I hadn't even got a clue about them. And they were amazing. They actually got me to be able to move about my house because I have steps all over my house, and I couldn't even get out the house for over 3 months because I have 6 steps down from my front doorstep. So without having that, I would have been trapped in my house for probably 4 or 5 months. I basically had no input from the healthcare system at the beginning. I did have physio after I had my plaster removed, which was about 3, 4 months later. But it was very limited, and they were great. I can't criticize them. Brilliant people, but they're very limited with what they can offer. Mm-hmm. So having spent 3 months in bed, I did do a lot of research myself, not thinking that I'd even need it. I just got into a bit of self-help and was listening to Dr. Chatterjee and Gabor Mate, and I also got into someone called Andrew Huberman, and it was all about neuroscience, and I found that all really, really interesting, how your mind can affect things. And actually, part of that is what I ended up using later on, but everything was kind of down to me at the beginning. I was also really lucky a bit further on that I found a physio that supported me in a lot of ideas and thoughts, and he's been brilliant, and I still go and see him now. So the healthcare that was actually supplied to me wasn't that useful at the beginning. And even further on, I still had to ask about pain clinics and things. I was never told about them. So it definitely doesn't work
I
desperately
think
well at the moment.
not at all. It's really demoralizing as well when I think our kind of conception of how healthcare works is that there are all of these people who have huge amounts of expertise in what is going on with you, and then you just get kind of sent away with no clear answers in a time which is already dead scary. You know, as you said, you kind of went from presumably functioning
Full fitness.
totally
Yeah,
normal
full
life
fitness.
to not in a really kind of freak accident, and then not having any support when you don't know how to navigate that yourself is such a, it's just an additional stress, isn't it?
It is, but I would also say it was right in the middle of COVID, and I think a lot of things also slipped through the net, but I wouldn't say that it would be massively different if it hadn't been COVID, but it was a bit more of a tricky time.
I think one of the things that you're absolutely right, COVID was, so many people were missed, and I think that a huge amount of the increase in chronic illness that we've seen kind of skyrocket recently could be partially linked to COVID, because everybody's life changed overnight, and everybody's ability to access the world and participate in things that would help them, whatever that means in their individual situation, was just kind of whipped from under us. But I think there's also that element where there's this expectation, isn't there, in healthcare, that if you have an accident, that you're going to recover in the kind of standard way. And when you don't, and I think a lot of the time when you don't, there are possibly signs there at the time, but they're not obvious enough to do something different. And it's in hindsight that you go, oh, hang on a minute, this actually needed more support than it
I think,
got.
yeah, I think it could have been flagged up a little bit earlier that this was going to be a bit of more of an ongoing thing rather than just something you're going to go in, get fixed, and carry on with your life as normal. Yeah, definitely.
It's this kind of issue with just everything being simple linear solutions. We're just kind of saying, oh, everyone, it fits the normal script that if you have an injury, then you will recover within 3 to 6 months. And, you know, one of the reasons that I called the podcast The Conditions for Recovery is that I often talk to the people that I'm working with about the conditions for recovery versus the conditions for chronicity. And I think the conditions for chronicity are often kind of a bit obvious when you look back, but are maybe
Yeah,
not that obvious when you attend A&E or when you're having surgery. It's that there's not enough space to identify those things presently, maybe in
I
the
think
way
that's
that
true.
healthcare is being run. Yeah.
Yeah,
And it's really frustrating to go, well, actually, in hindsight, this felt like somebody could have noticed, somebody could have flagged it, somebody could have done something about it beforehand. Um, but it seems to be I saw something in the news the other day about how everything in healthcare is reactive rather than proactive at the moment, and I think that's the system that we're kind of inhabiting at the moment, isn't it?
I think so. There's been a lot of talk about upstreaming and downstreaming, and if you can catch things earlier, you can definitely get things, have a better outcome, I think.
There's that image that you see quite often of the bridge, and the bridges of like lots of those kind of upstream, often kind of socioeconomic or deprivation related things that are the really core things a lot of the time for people, and yet we're doing the kind of what I call the tier one stuff, the kind of simple linear solutions, once it's often maybe a bit too late, if that makes sense. It's not too
Yeah,
late,
absolutely.
but it's also that some of that damage from not recognizing those more important factors upstream, you're kind of then trying to unpick and undo those things.
And it takes longer
Yeah, definitely.
Yeah.
I mean,
I'm
there's
going to
this.
apologise now. I'm going to have a wiggle because my back's a bit sore. So
Yeah, no,
if people see me
absolutely.
wiggling,
Please
that's
do.
why I'm doing it.
Katie, you do whatever you need to do to feel as comfortable as you can whilst we're having this chat, definitely. Um, so I guess the question is, in terms of, there are two sides to what you said earlier about not receiving a particularly significant or helpful advice and support from within healthcare, but also doing a lot of your own research and your own engaging with things. That I guess I'd ask this question in two ways. So the first one is how that lack of support and messaging from healthcare shaped your understanding of what was going on, but also how your seeking out autonomously things shaped it as well.
So basically, I'd say it gave me a distrust in healthcare, if I'm honest. Like, they're not really helping me. I'm on my own. I've got to do this all on my own, which is quite sad, really. And it makes it harder. But on the other side, all the research that I did, it's like, actually, I got quite into neuroscience, which is interesting. And gosh, there is something I can actually do about this myself. Um, I'm not just on the scrap heap like I feel at the moment. And there's things I can do. There is changes I can make, and actually, it might make a difference. And that was really helpful for me. Gave a bit of hope.
Yeah, for sure. I think the distrust is something that you see over and over again, and is one of the reasons why I wanted to start this project, is that there's so much information, some of it utterly mind-bogglingly wrong, some of it so unhelpful, and it just people come and tell me all the time when I'm working with them. I ask them, what are your hopes and expectations for why you're here? What's your insight into this? And one of the main things that people say is that they've been told by other healthcare professionals that no one really understands any of this stuff, and that we're just kind of floating around doing our best. And I think actually there are huge numbers of people, both who are living with pain and seeing improvements, and also huge amounts of clinicians who are working in a slightly different way. But every time that somebody has a conversation with someone where they say, we're going to offer this intervention or this treatment and it doesn't help, then I think instead of saying, well, that hasn't worked, but here is this idea, which is maybe slightly different from the kind of standard biomedical simple linear process, it's the fact that the kind of, there's so much chat in physiotherapy education about the importance of language use. And it's usually to do with things like describing what's actually happening to someone on a kind of physiological or anatomy level. But actually, the telling people that there are no doors for them, telling people that they just have to learn to live with something because your specific intervention hasn't helped, is deeply unhelpful and has really profound impacts on the way that people perceive their health potentially for the rest of their life. And I think the interesting thing, one of the reasons why I really wanted to talk to you, is because you had that experience of having to do it kind of all on your own from very early on. It immediately kind of reframes what you're doing from a perspective of having agency in the situation. So rather than being a kind of passive participant in just being led by experts, it's that, actually, what can I do about this situation? And I think I often see my role when I'm working with people as being a bit of a sounding board and providing guidance that may or may not fit their specific situation, and then them being the person who's kind of in the driving seat and trying to go and do the things and weave them into their own individual life. And you've kind of had to start from the very beginning with that because of your experience.
I did start from the very beginning with that, but I would say, as I said earlier, I've got a really supportive physio, and he totally adjusts things to fit around what I want to do. A random example is I live on a farm. I was desperate to climb up onto a combine harvester. That was one of my goals. And so that is what we aimed for. And we did exercises and everything. And it's finding what your values are and what you really want to do. And he makes life a bit interesting. He gave me dancing to do around the kitchen instead of normal ankle exercises because I could do it while I was washing up. It's just listening to me is probably the main thing. You've got to have the communication you were talking about is so important, but so's the listening. It's just some people have just never been listened to, and they just want someone to know that they've been heard, and then adjusting things to suit the person, not just the regular handouts that you get given. And that's kind of why I did Bob, because it doesn't work. I wouldn't have been interested just standing there doing boring exercises every day. I'd get bored of it. So
I think this
adapting
is
it to the person.
Totally. And I think this is one of the somebody posted on LinkedIn, somebody that we both know, Pete Moore, posted, it was maybe on Instagram actually, a poll, I don't know, 6 months or so ago, where he said, why aren't more clinicians that work in pain management and in kind of self-management and supporting people who are living with these things that are not fitting into these neat little boxes, not making more kind of content about it? And I think the overwhelming response was, this stuff can't be protocolized, it can't be given out as a one-size-fits-all, it has to be individualized, and it has to kind of focus on what makes the person feel like themselves. And you can't give out generic exercise about that. You can't give out generic handouts about that, because they're, I think, probably always going to miss the mark.
Yeah. And Pete's very into self-management. I'm quite good friends with Pete now. He's been very kind to me. But yeah, self-management is basically, you do have to do the work. It's not easy. You do have to do the work. And I know a lot of people think, oh, please fix me, which would be perfect, but it doesn't happen. You do have to take agency for your own outcome, basically, and that can be quite hard.
Really hard. I think it's one of the first steps, is recognizing that actually there isn't any simple answers here, and the answers, and this is the reason that I wanted to have these conversations, is because I have a fairly strong feeling that nobody's going to come on and say, I just did my exercise sheet from the physio and I just took this medication and now I'm 100% better, because the model that we're working in, I call it the chest infection model. You go and you say, I've got these symptoms to your GP, and they go, aha, I've seen that a million times before. That's a chest infection. Here's an antibiotic, and you get better 9 times out of 10. And we all know, who have experienced persistent pain or who work in persistent pain, that never happens. It's always about this kind of complex journey of realization that you're the person who has to figure things out. And I think we're still not delivering that in healthcare. We're still not recognizing that these things are not simple. I often see research and think, I feel it's a red herring, whatever it's being said, because we're still looking for that kind of magic bullet when it comes to these things.
Yeah, I totally agree. But something you said earlier, I think it's, we were talking about the fixing you. I think also people have to go through a bit of a grieving period, like when they realise that they can't be fixed. And actually that was a massive change in my mindset. It was awful while you're going through the grief bit, but actually I think you kind of need to do that. And then you'll be like, this is all I'm going to have for the time being. I know I might get better, but at the moment, this is where I'm at. What can I do to make it better? And hopefully that will improve things in the future. But you have to be really sad that actually your life isn't going to go quite back to how it was before, and that's quite hard. And I think people aren't always aware that that's kind of part of it.
It's that exactly what you said. It's the grief for your old life, the grief for the expectations and hopes that you had for things moving forward. And you know, the word acceptance is something that we really avoid using, or at least a lot of the people that I know who work in this area avoid using. And there's been papers done about whether the word acceptance is helpful.
I don't think it is.
I don't either.
Sorry. I think you can accept where you are at the moment. This is what it is. I can't change where it actually is at the moment. I think acceptance in that regard is necessary. Like, I'm not where I want to be.
Mm-hmm.
I accept that. But
I agree.
I think the word acceptance long term is probably not the good one, because I'll openly admit I'm still having treatment now, and I could accept where I am. I'm perfectly fine and happy where I am, but I'd still like it to be a bit better. So I want to keep striving towards that. So yeah, I'm not just accepting that I can't change anything.
And yeah, exactly. I feel like one of the main problems with the word acceptance is it's this kind of, it has connotations of resignation. And
Yeah.
I've spent a huge amount of my clinic time this week talking to people about how the two options are not either resignation or just fighting and struggling and pushing through all the time. There's this kind of happy medium where you potentially recognize and adapt to the current situation whilst also trying to improve, optimize, maintain, and also try to move forward. Because if we're just resigned, what's the point? You know, as you say, you could just accept it and be stuck in that place, and that doesn't feel like it's a beneficial process. It feels like it is essentially just resignation. And I think an awful lot of the rhetoric around this causes people to feel like resignation is the only answer. And I think that's very clearly not true, with the fact that people can have positive experiences of managing their situation. That doesn't mean, you know, cure. I deliberately use the word recovery because it's more vague than cure, because there are some people who are cured. There are some people who are saying, I really don't think this has any impact or meaning in my life anymore, but that's not the reality for a huge amount of other people.
It definitely still affects my life, but I have a really good life. But my ankles will never fully recover, and I've accepted that, but doesn't mean that I can't still improve what I can do with them.
Absolutely.
So, yeah.
So you've kind of touched on this quite a lot already, but I think it's worth delving into and exploring a bit more detail. So you mentioned kind of books and podcasts and various people who are talking in this space. And what do you think the process looked like of beginning to change your perspective with how you were moving forward from that hopeless, I'm not sure what to do and no one seems to be able to offer me any advice, to where you are now?
So I think I had to do the grief bit, definitely. Had to be the, oh my goodness, this is awful. How sad, I can't do this anymore. And then it's like, but I need to do something. What can I do? And I'd learned a lot about the mind-body combination. I don't know the word. And totally resonated with me that you can change the way your brain thinks about things. The whole neuroplasticity, where you can grow new pathways in your brain and you can get your brain to think differently. And I was like, well, everything's worth a try. So yeah, I tried things like gratitude. So when I was in the depths of my misery, I started writing a gratitude diary, and literally sometimes it would be not raining, ate a sandwich, because that was the highlight of my day. But I would say took a long time, and you do have to keep on at things. You can't just try things for like a few days. It probably took 4 months. And after 4 months, it's like my brain started looking for like the nice bits, and you start consciously wanting to find them. So that was quite a big difference for me. I did things like somatic tracking, which is where you kind of take the fear away from the pain that you're feeling in your body. I just started getting out a bit more, even though it hurt, because, well, if this isn't going to change, I may as well go out anyway. Yeah, there's loads of things I tried, and I just kept trying at them. Some things just didn't work. Like at the beginning, I tried meditation, and I was like, "Oh, it's a bit woo woo," not really me at all. And I know lots of people aren't interested in trying it, and my brain would be flying off after 30 seconds, couldn't concentrate. But actually, I do use it now, and again, the repetition, you get more and more used to it, and I find that really helpful too. So I don't know if that's what you were asking, but that's kind of
yeah,
things I
absolutely
found helpful.
There's a few things in there that I want to kind of revisit, and I think the first one is that being aware of your own preferences for things is really helpful, because I think a lot of these things are about kind of building confidence back up in yourself through all sorts of different techniques. But if the technique is alienating or off-putting to begin with, you're not going to be able to follow through with it. But I think also what you said that was interesting is that you now use some of the things that you were initially kind of put off by, and there is something about skill acquisition, habit formation, kind of going, well, this isn't going to be I do this once or twice and then I'm seeing huge amounts of transformative benefit. It's that you kind of have to do the work, I guess. And I think the problem is for a lot of people is that they feel that they're already doing a huge amount of work just to be where they're at.
But I mean, I literally meditated for a minute a day to begin with, or my gratitude diary took 30 seconds. It's just had a long calendar, and I just wrote the 3 things on the day next to the calendar, and I still do it now, actually. But it is just the hope that it's going to do something. Just keep at it. And do you know, if after 2 or 3 months it doesn't work, throw it out the window. Not my thing. But it might just work. So everything's worth a try. But don't try too many things at once, because it's like a project then, and you've got to fix yourself and you've got to do it. And that also doesn't work. Just try a few things. But it's definitely about calming your system down.
Yeah, for sure. And I think that's so different for so many different people. I often have conversations with people where I kind of start with a caveat that, lots of people derive enrichment and joy from socializing, but some people really don't. And I was at a training thing about frailty a while ago, and they were saying that a study had been done in which they found that being isolated when you didn't want to be was bad for your health, but being isolated when that wasn't something that you valued had no negative impact on your health. And so it kind of goes back to what we were talking about before in terms of coming up with one-size-fits-all answers. If we just tell everyone that social connectedness brings joy and enrichment and calms their nervous system down, there are lots of people that isn't the case for. And I think what you said before about listening to people, I always say at the beginning of an appointment, the first time that I meet someone, like, I'm sorry, I'm going to ask a lot of the same questions that you've been asked before, because I really want to hear things from your perspective, because that's the thing that's going to probably make us be able to kind of collaboratively figure out a bit of a path forward. It's not going to be me just saying, everybody do Tai Chi for 10 minutes a day, everybody meditate. And I think what you said about the kind of woo-woo element, I think it's so off-putting to so many people. I saw a review for a pain service years ago that said, utter nonsense. All they told me to do was meditate and quit my job. I was like, I really am very sure and hope that that isn't all that they said, but that is what landed, and it wasn't pitched to the right person because it was immediately off-putting. And it's a big problem that I have with the kind of mindfulness as this general generic treatment approach, is that it obviously is hugely beneficial to some people, and in your case was worth revisiting when you were in a place that you were more suited to kind of engage with it. But for a lot of people, as you say, they think woo-woo, I'm not interested in that, they're fobbing me off. And then you've lost someone before you've even started making any kind of meaningful improvement to their situation.
Absolutely.
And so, yeah, I do. I think I often say to people, deliberate relaxation, and it's like my deliberate workaround to using words like meditation or mindfulness. And what you were saying about the gratitude journaling and the fact that you started kind of finding positives in your day, I often kind of go, well, I don't know whether this is the dictionary definition of intentionality, but I say, try and use your senses to be present for little moments of joy or pleasure in your life, because those are exactly what you said. They're calming, soothing, and reassuring your nervous system when it's feeling in very kind of high threat and high danger. So yeah, that was really helpful. Thank you.
Excellent.
So in terms of what you've all just said, do you feel that there was a kind of specific turning point where you started to feel that you were more in control of the situation, or do you feel that it became a kind of gradual thing? You didn't know that it was happening, and then one day you're like, oh, I feel a bit more like I know what I'm doing now.
Do you know, I think it wasn't sudden, but it was quite it was quite a moment. So it was about 4 or 5 months after I'd hurt my back. And before that, I used to I live on a farm, I walked to the bottom of the drive and I think, oh, this is as far as I can walk. And then when I hurt my back, I couldn't even walk to the edge of the garden. And I'd been doing the gratitude diary, and I was able to finally walk to the edge of the garden. And I was like, I am going to be grateful for this moment for the rest of my life. I'm never going to moan what I can't do. I'm going to just be grateful for everything. And everyone was like, nah, you won't do that. You'll forget about this. And I haven't forgotten about it. And like every little bit that I can do, I'm just grateful that I can do that little bit more. And it was like a total switch. And I don't know whether it's because I'd hit such rock bottom that anything was a bonus at that point, but it was just a really lovely feeling, and I wanted more of that. So just started to really appreciate everything that I could do. And that was kind of the turning point. And then it's like, well, maybe I'll push myself a little bit further because I want to be able to walk to the bottom of the drive, and then you get to appreciate all the fields around you or that sort of thing. It's just a bit of encouragement, really, but it comes from yourself. And also, it's learning to not be so hard on yourself. Like self-compassion is really, really important. I used to be like, oh, why can't you do that? You're not doing it hard enough. You're not working hard enough. You're not thinking the right way. You're not doing all the hard work the right way, because everyone says you can just think about it and it's magically better. And that isn't the truth. So be a bit kinder on yourself. And yeah, I think that's really, really important. Be nice, but to yourself.
Yeah, for sure. I think there's so I changes depending on the day, but I often say that there are maybe 6 or 8 principles that seem to be very key for most people. They're recurrent themes in pain management, and one of them's about self-expectation. It's about going, what we were saying before, it's not necessarily about acceptance, but it's about going, right, this is where I'm at now, and I can either pretend that's not the case, or I can do what I'm doing and try and feel some sense of accomplishment in that. And then the other one is absolutely self-compassion. I think one of the most kind of frequent things that I hear when I'm working with people clinically is that they always put everyone else before themselves. They're always rushing about for or doing everything for everyone else. And I think that in and of itself is not obviously self-compassionate, but it also kind of creates an environment which makes it very challenging to be self-compassionate. And ultimately, being able to celebrate those small victories is hugely important from a kind of nervous system re-regulation perspective. Going, hang on a minute, I've just done something and I was apprehensive, and my expectation was that thing was not going to work. It's kind of expectation violation. It's going, right, I thought that this was going to be really challenging, and if I'd done it there and then, it probably would have been. But here's how I've come up with a method. It might have been a method that you did once and it worked, or it might have been gradually building it up. But that self-compassion is kind of at the heart of almost every part of trying to move forward when you're living with pain, because none of these things work well when you try and force them. None of these things work well when you use them as a stick to beat yourself with because you haven't done them to the absolute best possible capacity. And I think absolutely. It's about exactly what you said.
I'd also say about self-compassion is a lot of people feel like they're a burden on other people, and being compassionate with yourself and like, you can't help where you are. Like, well, you can help yourself a little bit, but you can't change the situation. And if you need help, don't feel guilty for asking for help. And the feeling you're a burden is quite, it's not very nice at all.
No, not
So
at
be
all.
kind to yourself. You're not a burden.
Yeah, absolutely. And I think that, the self-expectation, it's not just about getting yourself on board. It's then also about trying to get the people who you care about, the people who are your support network, on board, because so often they're trying to navigate something really complicated as well. It's, being the person that is trying to support someone who's really struggling is really challenging. And I think because we have so many ideas about the way that pain works and ideas about, people seem to think that everybody with X condition or Y condition have exactly the same experience. Oh, well, this person who's your colleague or co-worker has the same thing and they're experiencing less or different symptoms, so why are you not? Why are you experiencing those things? And getting other people along on that kind of compassionate, flexible expectation, adapted pathway it's a huge burden on the person who's living with pain. But unfortunately, I think a lot of the time, nobody else can do it. That kind of open, honest
Absolutely.
Conversations with people is... people can't read minds. I often try and get people's partners or mums or whoever it is that they're their kind of primary support network in for appointments so that they can actually be present for that conversation and listen to the kind of approach that we're taking. Because a lot of the time people are getting really kind of difficult messages, sometimes incredibly well-intentioned difficult messages, but difficult, unhelpful messages from the people who they're spending every day with.
Absolutely. Yeah, no, I totally agree with that.
Yeah. I feel like some of it's funny because, having structured questions that we've spoken about in the past, some of them we've already kind of touched upon, but
we have.
I think if you had to summarize what you felt would be really helpful for people struggling to know that you feel that you maybe didn't know at the start and do now, what would it be? That's a really difficult question to kind of come up with.
That is a really difficult question. or maybe I'll just say what I'm thinking and it might not answer your question. But
Yeah, I do.
basically, pain affects everything, and people need to be heard and tell their story, because it affects relationships, it affects jobs, it affects every aspect of your life, and your whole life gets turned upside down and you don't really know where you're going. And if you can find someone that does understand chronic and persistent pain or illness, they are the people to stick with, because they've got a better understanding and they'll help guide you, but you do need to do the work. And it's scary and you don't know where to turn sometimes, but there's always something you can try. Like, don't give up hope. Absolutely don't give up hope. It's it's so important to just try different things, and you will find things that will make your life better. Will you get a full recovery? I don't know. I don't know the answer to that, but you can make your life so much better, because my life is so much better now than it was 2 years ago. Like, utterly, it's completely different. I wouldn't be doing this.
Yeah,
This
for
is right
sure.
out my comfort zones. And yeah, don't give up hope. And there's definitely things that can be done to make your life better. Totally. That would be my outcome of this. But
Yeah.
also, I'd like to say, don't poo-poo the woo-woo. It's work. It works, and I've done a lot of research, and I'm really into listening to podcasts and reading papers, and the science says calming your system down, the mind body experience is it's just so important. And I openly admit I'm having therapy at the moment. I'm in an amazing place. um I'm happy with life, but I still want to improve things. And I know that my life experiences are affecting my level of pain, and I want to do something about it. So be open to having therapy, counselling, whatever. Do what you need to make yourself better, but you will have to do the work. And try and surround yourself with people that support you, because that's really important. That's
Thank
that's
you.
probably what I would say.
Yeah, thank you. Yeah, I think there's the loads in that. I think that the first thing is we've spoken quite a lot about kind of individual experiences and individual symptoms, but it's linking that together with what we were saying before about kind of generic protocols of treatment, is that individual symptoms require individual approaches. When people are really still stuck in this, there's got to be a magic wand, there's got to be a pill or an exercise, then that's a really difficult thing to move forward from. And being open and flexible to things, and for some people the woo-woo stuff is absolutely the thing that's going to help, and for other people it's going to be deeply off-putting. And I think ultimately it is exactly that each person's individual nervous system is sensitized for a reason that is unique to them. And so that means that trial and error is utterly key. And I think this is one of the dangers of using really kind of definitive language. We want to kind of work within the ambiguity in pain management, because saying this thing is utterly going to change your life is going to be true for some people and it's not going to be true for others. I'm really glad that you feel that you are moving in the right direction and that things are going so much better than they were 2 years ago, because this is exactly what the point is that there are people who feel that they're in a much better place than they felt, and yet so much of what we see and so much of what we hear, whether it's in expectation management in healthcare or whether it's in very kind of venting despair social media posts, neither of those things actually help people to move forward. They just kind of make people resigned to the situation they're in right now.
Or feel hopeless because, yeah, they've tried something and it doesn't work. That just means it doesn't work for them. But if you're told that this thing's going to be the miracle cure and it's going to make you amazingly recovered, you put all your hopes in it, and then your hopes get disappointed, and then you don't know where to turn. So yeah, try everything.
So much of it to do with expectation as well, like,
Absolutely.
and different people come with different experiences and biases, which mean that different things help. And you see an awful lot of things on social media that say, I've got this condition and I'm being suggested, or I've just been prescribed this medication. What do people think? And then people all pile in and say, oh, it was utterly useless, it's pointless. Or they say it's the best thing since sliced bread. And neither of those things are helpful to anybody who doesn't fit that person's narrative and experience that has led to them. So having a benefit from it and looking for these simple solutions, actually, I think is a barrier to being able to move forward. That flexibility in approach and in mindset is one of the kind of foundational things that helps people. So what do you think or feel needs to change in healthcare, education, or society when it comes to supporting people and changing narratives around chronic illness and persistent pain and living with complex health problems or conditions that have not fit a kind of more conventional, simple treatment pathway?
Okay, so I think we're all sold. You can go to the doctor, you'll get a tablet, get referred for an operation, medication, and you'll be fixed. And I think it just doesn't work with chronic pain or illness. It's not a one size fits all. And then you're kind of just thrown on the scrap heap a little bit. And that's not a nice way to feel. So I think they need to have better communication with their patients about what outcomes could possibly be. Also, patients need to know what's available. I mean, I didn't know even there was such thing as a pain clinic or community physios. You need to know what things are out there that you can even access. I also think that you need to teach patients that they do have to take agency over their outcome. They do have to put the work in. You can't just be fixed, and you have to try different things. I think pain can be very branded. Like if you look at all these help websites and things, they're all very branded, and you might get odd little bits that fit with you, but it just doesn't feel like anyone's really listening to you. So finding someone that you can really trust within the healthcare, I think, is really helpful if you can. And yeah, have them help guide you on how to do things. So I don't know if that answered your question.
Yeah, it definitely does. I think you're right. There's a couple of things, because the thing is that simple fixes are much more comfortable places for both the person who's living with the thing and also the clinician. We want everything that we're doing to have a very clearly defined outcome. And I think sometimes I feel when people come in and they're quite distressed, angry, frustrated with a healthcare professional, I go, well, yeah, that is a rubbish experience that you've had, but you're also working with a person who's probably feeling confused and defensive and attacked because their paradigm that they fit the way that they practice into it's not being attacked, but it's being destabilized, I guess, by your presentation. And it's not enough people, I think, are willing to admit that you can have personality clashes with a clinician. I remember when I was at university being told two things that fit into what you've just said. One of them was this kind of idea of detached authority about everything. You're supposed to present this kind of, I am the expert in everything. And I went to a university that was really good for kind of patient focus and health psychology, but I think you still see things about how we should be as clinicians, these kind of infallible experts. We should present this authority to people, when actually a lot of the time we're dealing in ambiguity and we're dealing in realistically informed opinions, because if somebody doesn't fit into that neat diagnostic framework or that neat cluster of symptoms, then everything's got a potential differential diagnosis that we should be functioning, and we should be practicing within that ambiguity a lot more. And, an awful lot, the majority of people, I think, absolutely have the capacity to understand, well, realistically, this could be a couple of things, rather than us just kind of, it's like we're, the layman's terms, the oversimplification, the reductionism to the point where it's no longer true, potentially. That's not helping people. So that, in terms of the way that we communicate with people. But also this kind of inability to recognize that sometimes the person who's working as the clinician and the person who is seeking support are not seeing eye to eye because of essentially a difference in personality. It's not that approach isn't helpful. It's that relationship isn't working. And I remember being really reassured by a post that was made about 8 years ago on Twitter about how it should be more normal to ask colleagues if you work in places if you can hand someone over. That actually recognizing, and there's a way to do it which is diplomatic, in a way that makes somebody feel like this is a collaborative decision that feels like it's going to be beneficial for both of you. But ultimately to say, hang on a minute, I'm not the right person here, and actually this might be better, this approach might be better, and this way of communicating might be better. We kind of say, nope, we are the clinician and we should be able to work with everybody, and everybody should be able to work with us. And actually, I think that recognition of that is not something which is done enough.
It's not talked about at all, is it? I've not seen that on any of the platforms. But also, you said something earlier about, like, I know what I'm doing. Not you saying that, but the training was, I know what I'm doing and you do kind of what you're told. I think people would respect a clinician more if they said, do you know what? We need to try a few things. Some things might work and some things might not work. I don't have the answers to everything. I think that's much more human, and you're more likely to have a better relationship with a clinician if they have that conversation than if you say, I know what I'm talking about and you do as you're told. And if you don't do it, because again, it's the expectations. You've given them something specific to do. It doesn't work. Well, then where do you go from there? I just think, admitting you don't know is actually quite a good thing sometimes. You don't need to know everything.
Yeah, and I think there's a difficulty as well in this, because as a society, we kind of have the hierarchy in healthcare. You've got the doctor who is expected to know everything about everything, even though they're working usually within a specialism and have knowledge on that specialism, and maybe have some kind of archaic knowledge from medical school 20 years ago about some other stuff, but they've specialized. They're brilliant at what they do. And yet there's the expectation. I get people coming and seeing me and asking me questions about things, kind of hoping that I'm going to know the answer. And I regularly say things to people like, I don't know anything about kidneys, like nothing. So you need to go and speak to someone who does about that, I'm afraid. And if you need some support with that, I can kind of signpost you. But we have this expectation that healthcare professionals somehow know everything about everything as a society. And I think a lot of the time healthcare professionals aren't willing to reveal that ignorance or that lack of having that specific expertise, and so kind of wing it a bit, and then that leads to worse communication because people are being given advice that it's well intentioned but isn't necessarily the right advice. I think also it goes back to that language use thing again, because you can navigate these situations in ways which really invalidate everything that you're saying to that person, or you cannot. And that kind of complex, nuanced communication is something that I think isn't talked about enough in either healthcare or the kind of lived experience space. People talk about the importance of communication, but it's often in quite kind of niche, narrow ways. And I just think telling anybody that, like, prognosis is a difficult thing. There are obviously times where it's really clear, but there are also times where it's totally off. And when we tell people that they can't see any improvement, that if they can't engage with what we're doing, then they're not going to get anywhere. And there's this idea, I think, there's been semantic change proposals about whether we should be saying that people are non-compliant or whether non-adherent is any better or vice versa. And it's like, well, hang on a minute. There are all of these other factors at play here, that could be having a huge impact on that person's ability to engage. But if we say, nope, if they can't engage with our very specific approach, then they're not going to be able to see any improvement at any point, that's incredibly limiting. And I think people take those messages on board an awful lot of the time.
Yeah, totally do. And that would be disheartening.
Yeah, for sure.
Yeah, yeah.
I think we've touched upon this again in some of the stuff that we said, but do you feel that there are specific narratives around pain that you've identified in your time experiencing it that you feel are not helping people, that you feel are possibly actively harmful to people's experiences of living with chronic conditions?
I think, again, it's if you can't be fixed, then what do you do? What do you do? And then you're kind of left, and then you think, what do people think of me? And people think, oh, moaning about pain again. And lots of people don't really understand how it affects you. So they're just like, well, you were fine last week. Why aren't you fine this week? We haven't done it. Or what have you done? What have you done to make your pain worse? Well, actually, I might not have done anything. It might just be that I'm having a flare up, or it might be something I did weeks ago. But it's people don't understand how it affects everything in your life. But I mean, it can even have chronic pain can also affect like bowel issues or headaches or anything. It can affect other parts of you that isn't where your actual pain is. And I think a lot of people don't understand that everything is all kind of tied up together, and the impact it have on you. It's not just you broke your ankles, you're going to get better. It might take a while. You haven't done enough work to make a full recovery, or there's just so many negative connotations if you don't get fixed. And I think I call it what do I call it? Like empathy fatigue. People get empathy fatigue. It's like, oh, you're not over it. So I think there's a lot of narratives attached to having chronic pain, and I think what is out there is you get fixed and you don't always get fixed. And that's kind of where we've got to change that narrative and support those that don't get fixed.
We touched on this in the conversation that we were having earlier today before we started this episode, is that actually these things are embedded everywhere in our culture. They're embedded not just in the medical system, but they're embedded in the way that we think and talk about these things in general life. I don't think anybody, I don't know, it's a long time since I went to school, but I don't think we're talking about the kind of science behind pain in schools. We're not talking about the kind of complex mixture of physical, psychological, social factors that are all feeding into people's experiences of just living their lives, and what happens when that changes because of pain, or changes because of fatigue, or changes because of any symptoms. And It's hard to know. It feels like the narrative needing to change is where, in some ways, where do you start, you know?
Start at school. Start
Yeah,
with the
yeah,
little
yeah,
ones,
yeah.
definitely. And don't have the books where you go into hospital and you come out and everything's perfect. I think you could even, yeah, teach them about how the brain works and the body works and the systems work and how it's all tied up together, how your thoughts affect things. Yeah, we didn't really touch on the biopsychosocial, whatever they call it. It's everything. Everything is a part of your pain. It's everything affects the levels of pain that you have. So you can't just put it down to damaged tissues. It doesn't apply to just that. It's everything. But yeah, starting in schools is probably quite a good thing if I think about it.
I think you know, what you said before, this kind of, this false dualism, this dichotomy between things are either real, valid, physical problems, or they're not, is where I think a lot of this goes wrong. Because, you know, the amount of times that the kind of "it's all in my head" or "I've been told it's all in my head" narrative comes up, and I have to say to people when it comes to that, nothing's all in your head. Nothing is all physical. Nothing is all psychological. We are not bodies and brains. We're people who have a brain and have a body, and that body and brain are practically worthless without the other. And they're also situated in the environment that we live in, and that they're being constantly influenced and changed by the experiences that we have. And when we just say, well, people either fit this very simple biological definition of health or they don't, I think it leaves people to kind of fall through the cracks in both society and also in the way that healthcare and medicine treats them, works with them.
Yeah, we're just all breathing, living creatures that are everything, whole nervous systems, hormone systems, every system, psychological, bodily, everything. We're just a mishmash of everything, and people have to see us as a whole human being rather than just bits that need to be fixed. Or, yeah, it join the brain and the body totally.
I think that is, it's there's a discomfort in it because it's nice and simple to think that your knee exists in a vacuum, your elbow exists in a vacuum, your lungs exist in a vacuum, your thyroid exists in a vacuum, and yet all of these things don't exist without the whole, and they're all being influenced by so many kind of complex factors. And it's just a lot more comfortable and easy to say, well, your ankles are the problem, and that is that, you know?
Yeah, exactly.
Is there anything I haven't asked that you wanted to discuss?
I don't think so. I think we've ended up covering everything, but yeah, no, I think we've covered everything for the
Great.
time being while my
Yeah,
brain works.
yeah. I do wonder as well sometimes whether actually, as this kind of evolves, that if people were up for it, having them kind of come back, have more discussions, because in some ways it shouldn't just be a here's one person's story and then we're never going to have anything to do with them again, you know? Um,
So I'm actually
so
having some trauma therapy at the moment, and I'm open about that. So it might be interesting for me to come back and see if that's had any effect on my pain levels, because that's the reason I'm going there. I'm going there for health and pain reasons, and it might be quite interesting to have a conversation about that.
and there is, I mean, there's a huge amount of people who are living with persistent pain have something else in the background, right? It's and that something else in the background could be kind of big T trauma, or it could be small T trauma. So it could be kind of repetitive, cumulative things that may not have been a significant impact. Or they could have had a really significant catalyst event. But ultimately, people tend to experience persistent pain and chronic illness often, and there's all sorts of obviously nuance and complexity to this, but often when there's something else that's kind of added that foundational sensitization in their nervous system, and it would be interesting to talk about that.
Yeah. I totally agree with that, and I'm always said I'm going to be completely authentic, so I'll be very open about whether it works or whether it doesn't work. But yeah, I think it's interesting times, and I'm really hoping it does something. And if it doesn't, it'll be interesting to find out.
And I think we spoke about this fairly close to the beginning, but that kind of openness and flexibility to these things, that curiosity about, well, I kind of understand how this is relevant and I understand how it could help, and so I'm just going to go with it and hope for the best, is often a really good approach to take to one's health when they are experiencing chronic illness, persistent pain, long-term conditions.
And you have to be brave to do it.
You do have to be brave.
Like doing a podcast.
I think there's something in that, though, is actually bravery is part of it, to go into something that's unknown and to say, I'm not entirely sure that I believe in this, or maybe I do, or it's scary because what happens if the consequences are X, Y, or Z? That is brave, and I think that recognizing where you are is brave, and I think that recognizing your agency is brave. Processing the grief, like a huge amount of this is about that kind of bravery to start trying to navigate the situation that one finds themselves in themselves. I never really use the word bravery when talking to people about long-term conditions, but I think that's the people I've come across
that have chronic illness and pain are probably the bravest people I know, because they just keep going when they probably really don't want to. So yeah, hats off to all of them.
Absolutely. Thanks really loads for coming on and talking to me.
Thanks for having me on, actually. It hasn't been half as bad as I thought it would be.
Good. Well,
I've actually really enjoyed it.
Good. That's always the hope. If what Katy has shared today has resonated with you and you'd like to connect, you can find links in the show notes. Thank you for listening to the Conditions for Recovery. I'm George, and I'll see you in the next episode.